Hello friends, I am Dr. Shashi Jindel, the consultant obstetrician and gynecologist working in Bhagirathi, Neotia. Today I have been asked to talk about profuse bleeding during menopause. So to understand menopause, we must know that what exactly is the menstrual cycle. So in menstrual cycle, what happens in the first half, it is estrogen dominant, and in the second half, it is progesterone dominant. So, under the influence of estrogen, the lining of the uterus gets thickened, and when the egg releases, the other hormone progesterone comes into picture, and it neutralizes the estrogen, and the lining comes out in the form of bleeding. So, what happens with the age when you are approaching mid-40s? There is little bit disturbance in the hormone secreted by ovary. So that time we get disturbed, but generally it is a perimenopausal bleeding which is lasting for sometimes even 10 years. Some patients take only 2-3 years in perimenopause, and some can go up to 10 years. So this becomes a very difficult situation because disturbance, ovulatory dysfunction is causing abnormal bleeding, and you can't understand that what's wrong. Why my periods are sometimes so heavy, sometimes they are just scanty, sometimes they are not stopping only. So this period is very difficult for the patient to understand. So my advice is that during this perimenopause phase, you should not worry about the cycle, but you should make one consultation with your doctor so that you have an idea that whatever is happening with my body is normal or not. So we generally find out by doing hormone test, by biochemically, and by doing other hysteroscopy, radiological tests, etc. And we label you as perimenopausal bleeding. Perimenopausal bleeding is diagnosed when the lady is having kind of irregularity. Then we diagnose it by hysteroscopy, biochemical test, etc. And if all is okay, there is no other reason for this abnormal bleeding. You are given green signal that okay, you can just have one yearly checkup and it's okay. But if the bleeding is post sex, after intercourse, if the bleeding is there, that could be problematic because it can be a polyp which is residing inside the endometrial cavity. And if the bleeding is happening after stopping of periods for 1 year, then it is called menopause. When the period is completely off for 1 year, that time we label it as menopause, and then if you have bleeding, it's really a cause for concern. And that time you should be fully investigated. We have to rule out polyps or any endometrial cancer or any other structural abnormalities, etc. So that time we again do all the tests, and you should never ignore the post-menopausal bleeding. Treatment depends on the cause. If the perimenopausal bleeding is just due to ovulatory dysfunction, etc., then we wait and watch. But if the bleeding is due to some polyp, or patient is having high risk factors like diabetes, her BP is high and she's obese, then we have and also there is family history of malignancy, then we have a doubt of endometrial cancer. So that time it should not be ignored. Profuse bleeding, if it is happening, then we can give hemostatic preparations to decrease it, because in some cycles you are not ovulating, and the opposite hormone which neutralizes the effect of estrogen is no more there. Progesterone is not there. So without ovulation, when you have anovulatory cycle, the bleeding can be really profuse. But there is no other reason for that. So in those cases, you can simply take tranexamic acid, etc., to decrease the bleeding. We sometimes prefer to give OC pill, oral contraceptive pills also, because this is the time period when your periods are not regular, and you can sometimes, because of the late ovulation and all, you can get stuck with unwanted pregnancy. So that time you have to be extra cautious, and if we treat you by giving oral contraceptive pills, that is okay. That means helps in avoiding pregnancy, and proper treatment happens after taking this OC pills. So viewers, I have given you a brief introduction about perimenopausal bleeding along with postmenopause menorrhagia. Thanks for watching the video. Thank you.